Kyokushin Karate is renowned for its rigorous training, physical demands, and formidable techniques. While practitioners benefit from the discipline's advantages, ranging from improved fitness to increased self discipline, the inherent risk of high impact training means that injuries can occur sometimes unexpectedly. Addressing these injuries effectively is crucial for both recovery and the overall longevity of a martial artist. This video explores common injuries associated with Kyokushin Karate, the rehabilitation process, and tips for effective recovery. Before delving into the rehabilitation process, it's essential to recognize the types of injuries typically sustained in Kyokushin Karate. These injuries can generally be classified into acute and chronic categories. Here are some examples of acute injuries. Number 1. Sprains and strains. Twisting or overextending joints during techniques can result in sprains, most commonly affecting ankles and knees. Muscle strains, particularly in the hamstrings or quadriceps, may also occur due to intense physical exertion. Number 2. Fractures and breaks. High impact strikes can lead to fractures in the hands, feet, or even ribs, especially during training or competition. Number 3. Contusions. Those involved in full contact sparring can develop bruises from strikes that can leave lasting discomfort. And number 4. Lacerations and abrasions. Given the full contact nature of Kyokushin, cuts can occur especially from training with partners or other striking surfaces. Next, let's get into some of the chronic injuries that can occur over years of practice. Number 1. Tendinitis. Repetitive motion, such as those involved in striking and blocking, may result in tendinitis, primarily in the shoulders, elbows, and knees. Number 2. Joint issues. Over time, repetitive stress without adequate recovery can lead to conditions like arthritis, particularly in weight-bearing joints like the knees and hips. Number 3. Stress fractures. These are small hairline fractures, often caused by repetitive impact on bones, commonly affecting the feet and shins. Recognizing an injury is the first step towards rehabilitation, and understanding how to manage the particular injury in play is vital for any dedicated martial artist that desires to keep on training and strive to get better every time they step onto the dojo floor. The first moments following an injury are critical. A common acronym to remember when dealing with acute injuries is R.I.C.E, which stands for R. Rest. Cease activity immediately to prevent further damage. I. Ice. Apply ice to the affected area for intervals of 15 to 20 minutes to reduce swelling and inflammation. C. Compression. Use a bandage to compress the injury, helping to minimize swelling. Ensure that the bandage is not too tight to impede circulation. E. Elevation. Elevate the injured limb above heart level to reduce swelling. After addressing the immediate injury, seeking professional medical advice becomes paramount. A physician or sports specialist can determine the severity of the injury and provide insights into a tailored rehabilitation approach. Imaging techniques such as X-rays or MRIs may be employed to assess fractures, tears, or other internal damage. After assessing the type of injury that occurred, developing a rehabilitation plan is crucial. The rehabilitation process for Kyokushin Karate injuries typically leaves no stones unturned, focusing on restoring function, strength, flexibility, and overall endurance. Here are some essential elements to include in your rehabilitation plan. Number 1. Pain management. Use anti-inflammatory medication as advised by a healthcare professional to manage pain and control inflammation in the early stages. Number 2. Physical therapy. Engage with a licensed psychotherapist that can provide you with personalized therapy sessions and give you specific exercises to do by yourself at home. These sessions may include passive and active movements, strengthening exercises, and modalities such as ultrasound or electrical stimulation to promote healing. Number three, gradually return to activity. As recovery progresses, gradually reintroduce movement. This phase may begin with low impact exercises before advancing to more rigorous activities. This ensures the body adapts without overloading the recovery tissues. 4. Strength and conditioning. Once cleared by medical professionals, targeted strength training is crucial. For instance, injury specific exercises can help rebuild the affected muscle groups while preventing re injury. Number 5. Flexibility and mobility work. Regaining flexibility is vital. Gentle stretching and mobility drills can improve range of motion and prevent stiffness. Number 6. Give psychological support if needed. Dealing with injuries can take a toll on mental health. Anxiety and frustration are common, especially with high level competitors. Don't hesitate to speak with a sports psychologist to discuss fears or concerns about returning to the practice. Once a full recovery is achieved, maintaining the body's condition is essential to prevent further injuries. Here are some tips for continued wellness. Number 1. Listen to your body. Understand the signals your body sends. If you feel persistent pain, do not push through. Consult a professional. Number 2. Cross train. Engage in complementary activities like swimming, yoga to enhance flexibility, strength, and balance. Number 3. Warm up and cool down. Incorporate comprehensive warm up and cooling down routines in every practice to prevent injuries. Number 4. Use proper technique. Regularly review and practice techniques and fix any mistakes under the guidance of your sensei. A small adjustment in technique can significantly minimize stress on joints and muscles. Number 5. Take adequate rest. Ensure that you incorporate sufficient rest and recovery time into your training schedule. The body needs time to heal and recover, especially after intense sessions. In conclusion, injuries are an unfortunate aspect of practicing any contact sport, including Kyokushin Karate. Understanding the types of injuries, implementing an effective rehabilitation process, and committing to long-term maintenance strategies can facilitate a healthy recovery and prepare practitioners for further training. Remember, while the physical toll may seem daunting, the journey back from injury is also a testament to the martial artist's character, reinforcing resilience, mental toughness, and respect for one's body's limits. By embracing a proactive and informed approach to injury management, martial artists not only safeguard their physical health but also enrich their overall training experience, laying the groundwork for continued success on and off the dojo floor. Arigato. Train hard, stay strong, and if any injuries occur, be patient and trust the rehabilitation process that will get you back on the dojo floor even stronger than before. I will see you all on the next one. Os.